of the Marathon County Board of Supervisors to order. I would ask that everybody on the call to please mute your phones if you are not speaking. Item 2 on the agenda would be for public comment. I have had one person contact me. Amy Litzer, would you proceed to give us your public comment, please? Are you there, Amy?
Can you hear me?
Can hear you now. Please, state your name and your address, please.
Okay. My name and my address is Amy Litzer. I reside at 500 Grand Avenue, apartment 408 in Wausau, zip code 54403. I wanted to address everyone on public health and safety regarding the area of 425 Wind Ridge Drive in Wausau with the buses. With the lack of transportation to the 425 Wind Ridge Drive in Wausau for medical appointments, the lack of not having a working shuttle from Aspirus during the hours of only 9 a.m. till 3 p.m., it leaves those who are disproportionately physically and mentally with disabilities and who rely on it stuck after those hours trying to get from their medical appointments back down to the hospital. And then during winter, some of those times we get stuck in snowstorms. The other businesses that rely on the shuttle also include Wausau Family Medicine, Aspire Family Cardiology, GI Associates, Wausau Pain Management, Wausau Eye Care Center, Ascension, and they would like to see the expanded transit to this area. It could help improve the physical and mental health equality in Marathon County. It also increases access to medical care, healthy food, vital services, employment, and social connections. So yeah, they're saying the issues like that is a transportation barrier to healthcare access, and during winter, the Aspire shuttle does not have four-wheel drive, and without it, people are stuck without transportation. So they would like to see some other ways for these people to get around up to their medical appointments without relying on the taxis to get them everywhere. So
Okay.
it's a big problem.
Yep. Well, thank you for your comments, Amy. Nobody else has registered that I know of, so I think we will move on from there.
If I may, Mr. Chair.
Yes, go ahead.
Just for purposes of the participant list, we have a call-in user, first four digits 7156, last two digits 60. If you can identify yourself, please, I'll rename you in the participant list.
Kelly Gaber.
Thank you, Supervisor.
Okay. Anybody else? Nope, I think we're good. Thank you. All right, item 3 is the approval of the October 6, 2021 Health and Human Services Committee meeting minutes. Those were sent out in the packet. Hopefully you had time to review. Are there any additions or corrections to the minutes? Seeing none, a motion to approve would be in order.
Supervisor Harris with the first motion to approve.
Okay, Supervisor Harris and Supervisor Van Crey with a second. Any further discussion? Seeing none, all in favor say aye. Aye.
Aye.
Opposed?
Aye.
Motion carried. Thank you. Item 4 is an educational presentation and committee discussion. 4A is an update from representatives from NCCSP Executive Committee relative to recommending modifications to the Tri-County Agreement. With us, we have Jared Nickel from North. No, that's a different option.
Yep, that is a different one.
Oh, I'm sorry. I got ahead of myself. Go ahead.
Sure,
Go
this
ahead.
is Administrator Leonard. Thank you, Chair Butke. And Kurt, Chair Gibbs will also take this item with me, and I'll try to be relatively brief. This is just an educational update. So as you may recall, as part of the review that we had obtained from Von Briesen and Roper relative to the Tri-County Agreement, or relative to North Central, related to taking a look at the Tri-County Agreement and examining whether there were opportunities to make some modifications to that agreement. And just to ground everyone on the committee again, the tri-county agreement that creates North Central Healthcare is that foundational agreement under Chapter 66, specifically Section 66.0301 of the Wisconsin statutes. It's an agreement between Marathon County, Lincoln County, and Langlade County for a mechanism, a regional mechanism, to deliver core responsibilities of each of the member counties. So under Chapter 51 of the Wisconsin statutes, Chapter 51.42, counties are mandated, specifically the County Board of Supervisors is mandated with providing various mental health services on behalf of the residents, particularly those crisis services. So that's the genesis of North Central Healthcare, is that intergovernmental agreement between those three counties. So we asked Van Briesen and Roper, and we being the North Central Healthcare Board, asked Van Briesen and Roper to take a look at that tri-county agreement and identify some opportunities for us to enhance, I guess, a couple of big themes, similar to the rewrite of the tri-county agreement in 2016. Two themes that we asked Van Briesen to look at: enhanced, I guess, responsiveness to specific county government needs, and also how can we just improve functioning and or transparency within those operations. So Van Briesen did come back, Attorney Andy Phillips did come back with a couple of suggestions relative to some ways we can go, and I'll try to be, I'll attack this from a high level. Essentially what Andy looked at was the statutes that we would utilize to form the intergovernmental agreement. And that might seem a little nuanced, but I'll try to dive in a little bit here. Under Chapter 51, there are two ways that a county can deliver its mental health services. In the state of Wisconsin, there are those counties that have an administrator and or an executive. So Marathon County, of course, you have vested your some of the powers within the office of the administrator. Other counties, such as Portage County, have an executive model. So there's the administrator or executive model for delivering mental health services, and then there's the administrative coordinator model. So counties such as Lincoln County, for example, has an administrative coordinator, and those statutes call for the operation of a community programs department, which is what North Central at its core is under the tri-county agreement, a mental health department. It's formed different ways in those two different areas. In an administrator or executive model, the supervision for the director of community programs is the county executive or the county administrator. In an administrative coordinator model, administrative coordinator county, a lot of those powers and authorities live within a community services program board. And that language might seem familiar to you because we have a community programs board, right? The North Central Community Services Program Board. And you would aptly ask, why do we have such a thing when Marathon County is an administrator county? It's a very good question, and the answer is because when you join together with other counties under Chapter 51 to deliver those programs, you by default, if you proceed under Chapter 51 and under that realm, you're shoehorned into that administrative coordinator model, which is again the North Central Community Programs Board, or the Community Programs Board in any other multi-county situation, has a lot more direct control over operations and policy decisions within that multi-county department than they would in a single county department of community programs if it was an administrator or an executive model. So with that background, Andy Phillips, essentially what he did was he identified a mechanism for us to pursue a model that was more in line with a county administrator or county executive model. And the way he did that was he's recommending we take a look at Chapter 59.52, subsection 7, to to organize and create the same organization, North Central Healthcare, to deliver the same services, but essentially it would allow us to organize ourselves and align authorities and powers in a more administrator, executive-led county fashion. So Andy drafted some potential revisions, and as you know, any revision to the Tri-County Agreement needs to be approved by not only the Marathon County Board, but the Lincoln County Board and the Langlade County Board. We essentially would need a new Tri-County Agreement. So we had that meeting, I believe that was last week, of the full North Central Healthcare Board. The Executive Committee is going to really dive into those recommendations. From a high level, for those of you that have been on the board for a while, you'll recall that in 2016, one of the amendments, one of the features of the amended Tri-County Agreement that we put in place was the creation of a retained county authority committee. Kind of off to the side, if you think about an organizational chart, you had the North Central Community Programs Board, and then you had the retained county authority committee. And that retained county authority committee was trying to do some of those things that Andy referenced, right? Provide some features that would ensure more enhanced responsiveness to county government needs. North Central's done a really good job, for example, of addressing community-wide needs. But there are some features of that tri-county entity that work really well on the community side, but they are a distinct, they're not a Marathon County only department. So they operated in a multi-county department model where the tie to the sheriff's office, for example, just isn't the same as if it's Marathon County Social Services and the sheriff's office. So this new model that Andy's put together is really, in a lot of respects, as I read through the draft, it's very similar in a lot of respects to some of the features we had in that retained county authority model in 2016. The one distinct feature that it makes is it specifically calls out that the intent of this agreement is to operate under Chapter 5142, where it's that administrator or executive-led model. It puts in a very clear policy statement. That's our desire. So the Executive Committee of the North Central Healthcare Board is going to look at that. We'll keep this committee informed, and this will be the committee that, of course, if there are any changes to the Tri-County Agreement, we'll come and present them through this committee to get to the full county board. But this is really, again, that product of that initial review that started quite a number of months ago with Van Briesen and Roper, and I think Andy's given us some good food for thought. But that is the high-level overview. I already talked more than I wanted to. Chair Gibbs, I'm sure, any corrections or additions that I should have offered?
No, I think you hit the nail on the head, and it's not that we're trying to change the operations at NCHC. It's just there was some issues that were enlightened, that were conflict between. There wasn't consistency between statute and the authorities that we had authored in the Tri-County Agreement. So there was some challenges, and so this opportunity provided is going to provide an opportunity to clean those areas up and spell out roles and responsibilities that provide clarity where they were a little bit blurry before.
So if anyone has any questions about what that process looks like, again, it's just keeping you informed. Under the existing Tri-County Agreement, this is the committee of jurisdiction it was the committee of jurisdiction for retained county authority representatives. So we continue to bring periodic updates back on all things North Central, as is your item 6A, and that we'll get to in just a minute.
Well, thank you both for that presentation. I just had a couple of questions. How long has the Tri-County Agreement been in place?
The current one?
Yeah.
Is April of last year. Was it March?
May of 2020.
May, okay.
Okay.
So the previous So real quick history, North Central's been in existence through that intergovernmental agreement for decades.
Yeah.
However, we had the same intergovernmental agreement for the vast majority of that period. In 2015, we undertook the effort to do our, what I'll call the initial revision, which led to the creation of the Retained County Authority Committee, which had members from the administrator from Marathon County, it had, or their designee, the administrative coordinator from Lincoln County or their designee, and the administrative coordinator from Langlade or their designee, as well as one additional member from Marathon County that was appointed by the board. That happened in 2016 was when that went into effect. In 2020, we revised that agreement because one of the key features that we made in 2016 was we made the agreement time limited. So that was one of the critiques to the long-standing agreement, is that when you have a contract that's in existence forever, it doesn't give the parties a great deal of incentive to come together and try to address issues in a timely fashion. So we made the contract was 5 years in term, and it required the parties to sit down and really start talking after, I believe it was 4 years. So that's what we did, and the new agreement, the current agreement, was ratified by the boards in April of 2020, and it took effect May 1 of 2020.
All right, very good, thank you. Any questions from committee members? So the main purpose at this point, though, is basically clean up that, we're trying to streamline the situation. You gave a good explanation of the governing model type, I think, and it's a challenge to make those two mesh. I get that.
Yeah, it is, and I'll give, all credit goes to Andy Phillips for kind of identifying kind of this other path that was available. I had the pleasure of working with through the initial 2016 revision of the Tri-County Agreement and also the revision in 2020. We were working exclusively out of Chapter 51. Andy directed us to really take a look at this Chapter 59 and maybe be able to look at some things differently, which I think is there's certainly going to be things out of this that we're going to adopt without question. We just need to really take a good hard look at the entire document that he provided with his suggestions, which will take some time, but we'll keep this body informed.
Okay, appreciate that.
Yeah, I think, if I might, Mr.
Yep, go ahead.
The one thing, when the Tri-County Agreement, when North Central Healthcare was, and this is history now, is when it was originally formed, the 5942 didn't even exist. And that just came in existence not that long ago, and so it wasn't even an option when the original and some of the subsequent agreements were actually drafted. So, but a new option.
Okay. All right. Any other questions from any members? All right, seeing none, we will move on then to item 5, operational functions required by statute, ordinance, or resolution. We do not have any today. So on to item 6, policy issues, discussion, and potential committee determination. 6A is continued discussion of recommendation from NCCSP Board to reduce Mountain View Care Center nursing home licensure to 154 beds. I was a bit premature earlier, but we do have Jared Nickel with us today from North Central, and I think he would like to address that topic today.
Either that or you can come up here, whatever works for you. Okay.
Sure.
Right here?
Yep.
All right. Thank you guys again for letting me come again 2 months in a row to this meeting. So last month when I presented opportunity for Mountain View Care Center, which is operated by North Central Healthcare, looking at the bed licensure. So just to give kind of a little bit of a preface for how we got here. In 2017, when North Central Healthcare was participating in its revisioning of its campus, it was slated that Mountain View Care Center would be 172 beds at that time. At that time in 2017, Mount View was 200 beds. So there was a reduction planned when the completion would be done. Since then, Mount View has been reduced to 188 beds. So today it sits at 188. Plans long-term was 172 when this was envisioned. What we did is what the state allows is during a time of a major construction, you're able to put beds in what's called a reserve. So we've done that. So if you look on the state website, Mount View only shows up as 165 licensed beds. What that means is 23 of our beds are in what's called a reserve. It means we don't have to pay a bed tax on them. However, if we do want to admit someone in those beds or anything like that, we would have to bring those beds back online and then pay that bed tax on them. With that, what I brought last month to the committee was the ability to look at reducing further beyond the 172 beds for two major factors. The first being what our census and occupancy has been at, and the second factor of a switch in demand, I believe, from when the 2017 plans occurred to when the 2021 and where we sit today exists. So in 2017, when this 172 beds was envisioned, the plan really was intended that a number of those beds would be designated as what's called semi-private. Semi-private beds mean two people are in the same room. Today, the demand, if you look at a number of nursing homes throughout our state, throughout our county, and throughout the nation, the demand really is for private rooms. That's where you see people that they no longer want to share a room with another person. They want to be in their own room. There's also medical complexities that have changed in nursing homes that from a safety aspect and from a clinical aspect do aid in that, and the state is pushing that. So the state does provide additional revenue in order to push that quality measure with that. So again, that was the reasoning for bringing that number forward. Since that time, the committee did ask me to look into the demand, as Aspirus had brought forward that they believe there is a demand out there for 172 beds and believe that it wasn't in our best interest to reduce beds. So the committee had tasked me with reaching out to Aspirus as well as Marshfield, which is the other major provider in our area. So to give you a little bit of pretext to that, Mount View Care Center receives about 90% of its referrals from those two providers, Aspirus Health System and then Marshfield Health System. So that's where most of our referrals come from. So it made sense of this committee to ask for those two. From that, both of the discharge and case managers did verify they would like us to have the number of beds. However, we're not able to give me solid concrete data before this meeting. So what I did in the meantime was reach out to the state. So I reached out to the Department of Health Services and had asked them a little bit more detail about this bed, putting things into bed reserve. So with that, the information that I got from the state is we have the ability to put as many beds as really we would like to, as long as they're actually under construction. The fortunate thing with us is we have a whole nother phase to Mount View Care Center that will be starting very soon here. So we are able to put basically up to our other half of our beds, the other 96 beds that we don't have renovated at this time, into reserve. So what the recommendation would actually be is, instead of looking to reduce at this time, I think it buys this committee time, it buys North Central Healthcare time to move 35 of those, or 34 of those beds, my apologies. So move to the 154 number, but do it in a bed reserve. So what that would mean is if in 12 months from now, the census at Mount View Care Center picks up. So today, to give you guys context, we're at 123. So if the census picks up and we're at 155 or 154 in 12 months from now, we would be able to move those beds out of reserve and give us that flexibility. What it does, though, in this time is it wouldn't make us pay for that bed tax. So we would save the dollars, but still have the flexibility. We're able to keep those beds in reserve for up to 18 months, or when the completion's done, whatever one is earlier. So with that, I would ask for the recommendation to move ahead with moving into 154 licensed beds, putting 34 in reserve.
Okay. Thank you.
Yep.
Any questions or comments from committee members? Yes, Supervisor Krause.
I am just sort of confused because it would seem to me that we have a huge number of elderly in this area, and with COVID, baby boom generation, you would think that there would be a need for more beds instead of less. Could you address that?
Yeah, so in that Clifton Larson Allen study that I provided to you guys last time, you are 100% right. There is an aging generation. The real difference is the need for healthcare, for skilled nursing healthcare, isn't as great. And the reason for that being is I had given the two other sectors in the assisted living, the RCAC and then the CBRF. So that community-based residential facility is a relatively new type of care, especially in the state of Wisconsin. So if you remember, a number of years ago when family care was enacted, it created what was called, an organization our area is called Inclusive, but family care created the ability for these assisted livings to take residents that would have been in a nursing home, and it was cheaper for the state because it was less Medicaid dollars being spent. So what happened is as this population aged, instead of going into the nursing home, a number of these people are going into these community-based residential facilities instead of the nursing home. And that's what that study really indicated, is that either people are staying in their homes longer, they're going to another level of care. They really are reserving going to the nursing home, A, because it's expensive. It's the most expensive besides the hospital. And then B, is it's the most restrictive setting. We have the most regulation, the most rules and everything like that. So the ability to have a different experience or the ability for an operator to modify the experience is limited. We're pretty well set in what the state tells us we can and cannot do. So, you know, you're exactly right that there is an aging population. It's just that we're not seeing that population go into skilled nursing. Just, again, due to other factors. The state influenced that. In other states, you are seeing that. But in the state of Wisconsin, again, largely due, honestly, to family care of why we didn't see that big influx.
Thank you.
Yep.
Jared, I had one question. Given that we have an 18-month period basically for a whole, would it be possible for you or somebody to come back to our committee, say in 12 months, say where we're at? Because we don't want to get to that drop dead date and then determine we're just going to release, or I think we'd like an update at least where things are at.
Yep, and I had suggested to Administrator Leonard that even me coming on a quarterly basis, I'd be willing to do so, whatever the committee thinks is best, just to keep an open loop of communication, give you guys status update on our census. Otherwise, I can submit a report that the committee could review, so you guys are able to see if there is that recovery. Like I said, our census, we are starting to see it increase. Part of that may be due to our new building remodel, but we do believe a lot of that has to do with there is a COVID recovery happening. People are learning how to operate and how to go through this in a different way than we did a year ago. So to your point, yeah, definitely be open to doing that.
Okay. All right. Any other questions from committee members? I think this largely addresses our concerns over this from a month ago. I mean, to be able to hold them in reserve, I think that's a good thing, that we don't have to pay the tax. So I think it meets the needs of the county, and you know, we'll see how things go. And if there, you know, if you want to put, whoever's going to make the motion wants to put in there some type of a reporting mechanism that we get a quarterly report, that's fine. But however you wanted to frame it. So, yes, go ahead, Lance.
Thank you, Mr. Chair. So the reason Jarrett's here today is he actually does need the county to give direction and approve this modification. So just to recap what North Central Healthcare and Jarrett is asking for is to, with that 154 operating and the 34 being held in reserve, I believe an appropriate motion, if you were inclined to follow the recommendation, would be to move to a bed licensure of 188 with 34 of those beds being held in reserve. Is that fair, Jarrett?
Correct.
Thank you for that clarification.
Mr. Chair.
Yes.
Well, thank you, Mr. Chair. Two things. One, I serve as the chair of the North Central Healthcare Board, and I also serve on the Nursing Home Operating Committee. There's also some other thing. I mean, Jared, you did a great job of explaining, you know, why the need to move to potentially the 154 license right now and put in those 34 on reserve. There's a bed tax that we pay on a monthly basis, but there's also, if we leave some of those double rooms in, there's a financial incentive to go to all single rooms. And the difference between a single room reimbursement rate of $1.50 per room versus $29 per bed, 29 cents per bed is the reimbursement difference. So, and then just to add to that, as all businesses are starting to see, there is a challenge in staffing. And so being able to provide enough staffing to move to the 188 is really going to be challenging. But we've got time now to actually understand where the capacity and the need is in the community, when we're fully recovered. But the other thing I think that they're seeing is we're seeing other opportunities that weren't here historically. We're seeing the CBRFs. We're also seeing community, the family care, which now is, taken over by another entity. Inclusive is the entity that took over family care. And that provides the least restrictive opportunity for individuals that need some form of assistance rather than going to nursing homes. So I think this buys us, time until the reconstruction is done, but we'll have a better understanding of where that capacity is actually at, and whether or not, and save the dollars that we were paying in room tax.
All right, thank you. Any other comments from committee members? Oh, is there?
Is there anyone?
Chair Butkey,
Yes.
There you go, John.
this is Supervisor Robinson.
Hi.
I want to, I'd like to thank Jared and others for reaching out. And I would hope that dialogue with the other healthcare providers would continue. I think this is a reasonable approach. It saves us the dollars that they were looking to save through the bed tax, and gives us a little bit more time to fully understand directionally where the demand for nursing homes will be in the future. So I think this is a great solution to the concerns that were raised by other healthcare providers in the community.
All right, thank you. Any other discussion? Seeing none, I would accept a motion in the form that Administrator Leonard put forth to approve this. So can I have that motion from someone? You want use the mic, please? Yeah, there you go. Yeah.
So I move to have 188 total beds with 154 in operation and 34 in reserve. Is that correct? And then I don't believe that it's necessary for you to attend quarterly to our meeting, but a report, I think, just in our packet would be good.
I'd like that. Yeah. Is there a second to that motion?
Supervisor Seibert, second.
Okay, Supervisor Seibert with the second. Any further discussion? Seeing none, the motion on the floor is to go to licensure of 188 beds, with 154 being active and 34 being held in reserve at this time, with a quarterly report being provided by North Central. Seeing no further comments, I will call the vote. All in favor say aye.
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 Opposed? That motion is carried. Thank you. Okay. We will move on to item 6B then, a review of the strategies and outcome measures for a strategic plan. Supervisor Van Curry and I met a couple weeks ago and kind of put some meat to the bones of our part that we're responsible for as a Health and Human Services Committee, specifically objectives 3.3, 3.7, and 7.2. I think what got sent out was just the empty template, but we, yeah, it's all right. We're okay. But we did fill in most of a review of what has been accomplished in the past year and a half by our committee. There clearly, we did some good things, but there were some gaps as well. And specifically, we did not find anything in, let me get this straight. Objective 3.7, item E, develop comprehensive mental health treatment options for criminal justice populations and others with criminogenic treatment needs. I assume I'm pronouncing that right. But we did not address anything on that. So that was one of the things that we didn't address. Also, under Objective 7.2, which is mitigating the impacts of heroin and methamphetamine epidemics in Marathon County through evidence-based practices. Item A, we did had a couple things listed there, but items B through E, we really did not address at all. And that's somewhat, well, largely due to the whole pandemic we've been through the last year and a half. And so that piece kind of took a back seat. Not that the problem has gone away here in Marathon County. What we really wanted to discuss today was, are those strategies listed under these objectives still valid? Are they ones we want to continue to address? Is there something that needs to be added, or is there something that really should be omitted here? We do have Vice Chair McEwen with us today as well, who's kind of heading up, coordinating the whole strategic plan. So, Craig, if you have some comments for us to go forward, I'd appreciate that.
Thank you, Mr. Chair, and the rest of the Health and Human Services Committee and staff. You covered a lot of information that I was going to mention, but there was basically 3 topics of the strategic plan that I just wanted to quickly cover with the Health and Human Services Committee, and that was to review the strategies for the 3 outcome measure, or the 3 objectives that this committee is the lead committee for, and also the outcome measures. Because and I had a discussion with Chair Butke as far as tracking these, and that would be the second topic, is that template that actually ERC committee developed it, and other committees have been using it because it'll make it a lot easier to track the progress that's been made on these objectives, and just because Health and Human Services is the lead committee for 3 of the objectives, 3.3, 3.7, and 7.2, some of the issues or topics that Health and Human Services may have dealt with could or may have helped implementing other objectives in the strategic plan. And then the third area was to stress that whether we realize it or not, we only have 6 months left on this term approximately. And we have 1 year left on the strategic plan at the end of this year. So my last question or suggestion was, is there items that this committee, policies that this committee specifically wants to accomplish or work on before the end of this term, which will be in April? So it's gone by very quickly, and the strategic plan will have to be updated at the end of 2022. So it's coming very quickly, and with this template, if all committees would utilize this template, it would make it a lot easier when we start looking at some of the outcome measures, which a couple of them, for instance, the 3.3, the outcome measure number 3, that measure was it said by December 31st, 2019, at least one practice change will be implemented with that is aimed at decreasing the number of youth young adults, I should say, age 17 to 20 in the 21 to Marathon County Jail, or that are subject to court-ordered services. I don't know if that's been accomplished, and like I said, but that one was 2019, and then also on 3, or was it 7 point? There's another one. 7.2, the first outcome measure. By March 1st, 2019, an outcome measure will be established to measure the quality of life for adults in counseling, mental health, or AOD-related treatment programs seen at North Central Healthcare. Now, there's been a lot of changes at North Central Healthcare with the remodel, and I'm sure there has been. But as Chair Butke said, this, some of this stuff wasn't documented, but you never know if you look back at the things that have been discussed in this committee for the last year and a half. There may be some items in these outcome measures that were accomplished. But as far as the documentation of it, I did get a copy of the template that Chair Butke referred to as being filled out, and it's easy to look at, easy to understand. Now, that template can be revised, to meet your needs as far as different that ERC. In fact, ERC committee did change some areas in theirs, and that I don't know if they have a copy of that one that's completed by ERC. It was in my packet, but I don't know if the rest of them have it. But it just gives you an example of how they've been tracking ERC's progress with implementing the strategic plan. So. And I guess to understand, things have changed since 2018 when this strategic plan was implemented. And there may be some, and I believe on the ERC packet that they have filled out, there's some areas that they feel should be deleted or removed from the outcome measures or the strategies because they don't, the ERC committee doesn't feel that they fit in with their strategic plan objectives. So, and that could be very well. This committee may have some suggestions on some of the strategies, some of the outcome measures, as far as things that could be, revised. And like I said, there's going to be a new 5-year strategic plan developed in 2022. So, but like I said, the information that's in the strategic plan. Don't just look at the objective, look at the strategies, look at the outcome measures, and then the departments that could be utilized to get these objectives move forward. So, and like I said, I think the start with the new template that that you have started on is a good move. But I just wanted to, I don't know if people if the committee members had a chance to look at that template, if there's stuff that they want to have changed on it. This committee's free to do that, with the chairman and the vice chair had worked on it already, so.
Right.
But basically, that's what I wanted to just touch base with as far as those 3 objectives. And then, like I said, seriously put some thought into what you would like to get accomplished before the end of this term, which is approximately 6 months, and we'll be starting a new term, so if we're back on the board. So does anybody have any questions on the committee?
Any questions for Vice Chair? Go ahead, Michelle, for you go first.
I just have a question more about the strategic plan process. So if this one expires at the end of 2022, does that mean beginning of 2022 we are going to start looking at a new one? Or
I'm going to leave that up to the administrator, but I believe so. I was on the 2018-2022 strategic plan task force, and we started that before. It was adopted in 2018 at our first meeting, I believe. But I don't know if the administrator has any. I know it's going to be before it expires.
okay.
Yeah, if I may, Mr. Chair. The intent, certainly from staff, is consistent with, again, should the board make it a priority to put in place a new strategic plan, I would envision that starting perhaps in first quarter of 2022, start identifying what does that process look like, to have something for the county board to adopt in 2023, early 2023, as Vice Chair McEwen referenced. We adopted this 2018 to 2022 plan in 2018. So I think having something adopted in 2023 is doable. We're going to have to talk about scope and what the process that the board wants to utilize for that. You'll recall, if you read through the strategic plan document, one of the features of this strategic plan was that board leadership directed staff to engage with community leaders and have what I'll call a focus group, work through the comprehensive plan to identify some of the lead or the priorities, I should say, to address in the strategic plan, which was then reviewed by the county board and staff added a fair amount of detail in terms of outcome measures before it was ultimately approved by the board. If that's the similar model we want to do, I think that's going to take several months. The other one additional piece we need to think about is your comprehensive plan. The board's comprehensive plan is that 20-year plan. That too had a component where the board recommended, and that was adopted in 2015, that every 5 years you would, or and certainly 10 years, you do a refresh of that document as well to identify were there new comprehensive plan goals, or there things, as Vice Chair McEwen referenced, are there things that you should take off the plan that are no longer priorities, or things that were priorities that the board made enough progress on that you can essentially check them off the list. So there's a couple of things we just are going to need to figure out how we're going to operationalize that. I would anticipate, and the vice chair can correct me, but I would anticipate that we'd probably utilize a task force similar to what's been utilized in the past, to task force or work group comprised of the county board and staff to take that on.
Yeah, as far as the task force, there were department heads, and I believe what they did was they assembled county board supervisors from every one of the standing committees. I believe there was public safety and ERC, and so there was a representative from every standing committee that agreed to serve on the task force along with department heads. And I recall it was almost a year-long progress, and we did start by reviewing, and I should have mentioned that, the comprehensive plan, because that was passed, but that's what this strategic plan was built off of, was the comp plan. So it's like I said, and I don't know what Chair Gibbs or whoever the chair is at that time, if they're going to go with the task force again. I'm assuming they are, and like I said, the comp plan will be probably reviewed in the process of redoing the strategic plan. And this strategic plan was one that wasn't just developed because I believe we're required to have a comp plan and a strategic plan, but it was the comp plan, the strategic plan were developed, it was put on the shelf, and nobody looked at it. And this term, it was really, this 2018 to 2022, we stressed that you work off of this strategic plan and the comp plan. And I think it's, the members that haven't been on here before 2018, I know before 2018, I don't even remember discussing the strategic plan or the comp plan. No. But this one is the first one that was really developed for us to follow.
Right.
So.
Well, and I think it's a good thing because it creates a focus. We're not just going scattershot all over and kind of reacting and putting out fires. It's here's our vision, our mission, here's what we want to do. But Supervisor Krause.
Thank you, Chair. I did look at those objectives and things, and I noticed that some of them I thought they was terribly outdated, that didn't apply to much what was going on, and I don't think there was anybody, any of your group or that was even working on some of those
Okay.
strategies or
Specifically,
objectives.
which ones?
I don't have it with me, otherwise, but I had it in mind, but I don't have it in
Okay.
front of me to tell you which ones,
Well,
but.
Yeah, if you'd like to email that,
okay.
your
All
specific
right, thank
ones
you.
that'd be great.
And then it would seem to me that 5 years is quite a stretch, because things are changing so rapidly now in the communications field, health field, everything. It seems to be changing very rapidly, and I'm thinking that maybe that's why a lot of that might be not applicable after 4 years, or, that haven't been really sought out as an objective to work on. So I guess that's, and I will get back with you on that.
Okay,
Thank you.
appreciate that. My thought is this, we've kind of put objective 7.2 on the back burner, and I think it'd be good to get an update so we know where we stand, and that would kind of lead in then to item C under 7.2, identify the gaps in programs and services and go from there, because right now, I don't know, and I doubt that anybody on the committee really knows either. So who would we get to do that?
Sure. This is Administrator Leonard, and I think a good place to start, and we can put it in your packet next time, but in previous meetings, we've referred to the update to the strategic plan. To Supervisor Krause's point, a lot of, there's not only does the county board utilize this document in terms of what policy do you want to address, to your concern, Supervisor Krause, about what actions are being taken. Staff utilized this document, if you look on, utilize the strategic plan to drive their annual work plans. So if you look on page 1 of the strategic plan, that's right in there, that the strategic plan, as the comp plan feeds down into the strategic plan feeds down into the committee work plans, what you talk about, but also it feeds into my annual work plan, and then it feeds into the annual work plans of the department heads that I oversee. So to Chair Butke's point about, where are we on objective 7.2 with respect to the mitigating the effects of heroin and methamphetamine, staff have done a lot of work. And if you look at the annual update to the strategic plan, we did, it's really, annual is a bit of a misnomer. We did it in 2020. Early 2020 it was approved. It gives an idea of all the things that have been done under each of the objectives, each of the 12 objectives by staff, and a great deal of that work by staff has gone through committee and was directed by committees, or committees provided insight, but staff have done a fair amount of work, and specifically to objective 7.2, we'd be happy to give you an update on where we are with some of those efforts. I can tell you that one of the health department, in terms of lead departments for objective 7.2, the county board, when it adopted the strategic plan, took what I think is a innovative approach relative to mitigating the impacts of heroin and methamphetamine. You are the standing committee of jurisdiction, Health and Human Services, as opposed to Public Safety. There was a recognition that really the drug epidemic, is largely a public health issue. It's certainly a public safety issue as well. We adopted as staff a similar focus. The health department is the lead county staff department on that effort. So you are probably thinking, well, they've been busy the last 18 months with something else, and that is true. So this, for the health department, did also go to the back burner, but we have done a lot, and we can bring you in, provide an update on what some of those things we've been doing. Public safety likewise has been doing a fair amount. The DA's office is very active in terms of diversion programs, what have you, as is our sheriff's office, and our drug court is one thing that we implemented during the course of this strategic plan. So we can give you that update, but I did want to reference that the document is not only a guiding document for the county board, but staff, we took direction from your policy decision in adopting this document. It drives our work as well. Certainly things change. My work hasn't been driven by quite as much this over the last 18 months as pandemic response, but still we try to keep as Chair McEwen referenced, we try to keep the strategic plan kind of top of mind as opposed to sitting on a shelf.
Sure. Okay. Other thoughts? Supervisor Van Cray.
You mentioned early 2020 there was an annual update.
Yes.
Would that be in a full board packet, or?
It's actually available on the website, and I
okay.
will send a link to all of the members in just a moment.
Great, thank you.
Okay. Supervisor McEwen.
Yep. Well, thank you. Yeah, and I believe I mentioned that the last update, and like I said, it's available online, and I think he sent it out in November of 2020 or whenever it was. But and I forgot to mention that again. But yeah, there is, and that does help me a lot. I look back. I wish I had a hard copy of it, but it's just on it's on a PDF or whatever you call them but it's available so everybody can get it. As far as that 7.2, and Administrator Leonard brought up, public safety and health, And I don't know if everybody has, this is a real battered copy of this, and it does designate the lead committees, the support committee, and the department leads, and exactly 7.2, Health and Human Services lead, Public Safety is the support committee, and the Health Department is the lead department. And that helps, with, as far as, who this committee should be dealing with, consistently with the support committee and the department that could help. But like I said, I don't know if everybody has this, but it's pretty nice to know who the support committees are. And the same thing with Health and Human Services and Public Safety. Their lead in support committee on several of the objectives with the designee as far as the departments that lead. And that's also your departments that contribute. The little circle in the bottom of the page of each one of the objectives lets you know what what departments are that can contribute to implementing this objective. So, but
All right. Supervisor Krause.
Just wanted to say thank you to Administrator Leonard and Supervisor McEwen for illuminating and clarifying this topic. Thank you.
You
thank
bet.
you.
Thank you, yeah. Other thoughts from committee members?
I'll be back in a couple months again just to follow up, just to keep everybody's
bet.
mind focused on their objectives, focused on the strategic plan. So
Good.
But thank you for your time.
Well, thank you for coming today. So, all right. All right. Seeing no further discussion on that topic.
If I
Oh,
may,
go
Mr.
ahead,
Chair.
Administrator Leonard.
Sorry to belabor the point, but you should all now have, I just sent an email with the link to that annual update document, as well as the document that Vice Chair McEwen referenced, the document that identifies the lead county board committee, as well as the lead staff department for each of the 12 objectives of the plan.
Appreciate that. All right. Item 7 on the agenda today is the next meeting time, location, announcements, and agenda items. 7A, committee members are asked to bring ideas for future discussion. So feel free to do that and hopefully kind of tie it in with what our strategic plan is, frankly. That's kind of what we're looking to do, so. The next scheduled meeting is December 1st at 4 o'clock, and hopefully you all can join us. Any other announcements today? Seeing none? Yes, Supervisor Krause.
For future topics, I might suggest that the Aging and Disability Resource Center, I spoke with Erin Wells about doing a presentation on disabilities. They focus on that, and she was quite interested in doing a presentation. And then I thought it was sort of interesting. I don't recall having had any programs on human trafficking, but Wisconsin is one of the top 5 states for human sex trafficking, and indigenous people get a disproportionate impact from human trafficking. So I thought those might be a couple topics we might want to address in the future. Thank you.
All right, appreciate that. And I do like that idea on ADRC, because it's been about a year since they reported back, and especially with Jonette leaving us at the end of this month, we'll have a little interim period, and then hopefully appointing a new executive director for that program in early 2022. So, and that committee does report up to this one, so it'd be good to have that from Erin. I can talk with her directly. I'll be talking with her next week. So, yes.
Thank you, Mr. I know I'm not on the committee, but several years ago, we had a joint meeting, a presentation from Joan Thoyer, the health officer, on ACEs, Adverse Childhood Experiences. It's been, probably 3 years, but it was a joint meeting between public safety and that. And it was an excellent presentation, and I don't know if things have changed, and I know that's part of the,
I remember that one.
yeah. So, just like I said, I'm not on the committee, but I would be happy to attend it if we would ever have another update on that.
A good suggestion, certainly plays into our strategic plan as well, so.
Yeah,
good thing.
absolutely. So, thank you.
All right, appreciate it. All right, anything else for the good of the order? Then I'll accept the motion to adjourn.
Motion by Supervisor Gonerich to adjourn.
Okay, and a second from Supervisor Van Cray. All in favor, say aye.
Aye.
Aye, opposed? That motion is carried. We are adjourned at 5 o'clock. Thank you.